Welcome back to my channel, and if you are visiting this channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the sciatic nerve. Let's use this image here for illustration. This is where we have the sciatic nerve here, harrowed at this point. It's seen as one of the branches from the sacral plexus that is located on the posterior lateral wall of the pelvic cavity. After its emergence from the pelvic cavity, it is seen to exit that space through the greater sciatic foramen, where it passed through the posterior region of the lower limb. And it is at this space that it gives innervations to both the skin and also the muscles of the lower limb. So ride on with me as I unfold the sciatic nerve, highlighting how this nerve emerges from the sacral plexus, the branches that emerge from the sciatic nerve, and also the different regions of the lower limb that they are seen to provide innervations for. This is the sciatic nerve that is harrowed here in black. This nerve, we say that it is an emergence from the sacral plexus. We know that the sacral plexus is a collection of nerves that is seen in the posterior lateral wall of the pelvic cavity. This sacral plexus is seen to produce a number of branches, one of which is the sciatic nerve. The sciatic nerve is the largest nerve in the body, and it is about 2 centimeters in thickness. And if you look at the configuration of the nerve here in this region that is harrowed in black, you see that it is actually large in size. This sciatic nerve is like a 2-in-1 nerve that is packed together. So you see, like, structurally 2 nerves that are held together and of course wrapped in a single connective tissue. The sciatic nerve, as we stated when we started this lecture, we say that it provides cutaneous and also muscular innervations for the lower limb. Let's go through this slide to establish how the sciatic nerve originates. We already said that this nerve is from sacral plexus, and we know that the sacral plexus is a collection of nerves seen at the posterior lateral wall of the pelvic cavity. And specifically, it is the ventral rami of the spinal nerves that is created around this region. So we have the ventral rami from the lumbosacral trunk. The lumbosacral trunk is basically the anterior or the ventral rami of L4 and L5 spinal nerves. So if you use this image here for illustration, the region here that is demarcated in dotted yellow is where we have the anterior rami of both L4 and L5. And these 2 rami is taken as the lumbosacral trunk. The second structural component of the sacral plexus is the anterior rami from S1 to S4. And this is what is seen to be highlighted here in dotted red. So you have a number of nerves coming together, specifically the anterior rami of the lumbosacral trunk, which basically is L4 and L5 spinal nerves, and also the anterior rami from S1 to S4. So this collection of anterior rami from L4 to S4 here is what makes up the sacral plexus. From the sacral plexus, we have the emergence of a number of nerves that are seen to give innervations to the skin and also the muscles around the pelvis and also the lower limb. One of these branches is the sciatic nerve, and this is the sciatic nerve highlighted in dotted blue. After the emergence of the sciatic nerve, you see it being directed to the lower limb, and this is where it provides sensory and also motor innervations for the lower limb. Before we dive into how the sciatic nerve emerges, let's try and go to the root of how the spinal nerve emerges. Using this image up here, this is the configuration of the spinal cord. And we know that the spinal cord is located within the vertebral canal. If you look at the spinal cord here projected in this image, this is on the one side. We also have the presentation on the other side. But looking at one side of the spinal cord, we have the emergence of rootlets. So in the ventral part, we have a collection of rootlets in the ventral part, and this is referred to as the ventral root. Also behind, we have another group of collection of rootlets that is referred to as the dorsal root. So you see that rootlets are collected together both in the ventral part, which is in the anterior part, and also the dorsal part, which is in the posterior part. This kind of presentation that is seen here is also exhibited on the other side. So these roots will then come together to form the spinal nerve. After the formation of the spinal nerve, we then have the spinal nerve further subdividing into the ventral ramus, which is in the front, and also the dorsal ramus, which is at the back. So you have this final division, and this kind of configuration that is seen in entirety is also presented on the other side. So this is how you have the emergence of the spinal nerve finally subdividing into the ventral and the dorsal rami. And this is what is presented here in this image. So the sacral plexus is formed basically from the ventral rami. Remember that the spinal nerve at this point we divide into two rami. We have the ventral ramus and the dorsal ramus. So the ventral rami from L4, L5, S1, S2, S3, and S4 spinal nerves are seen to come together at the posterior lateral wall of the pelvic cavity, where they will be forming the sacral plexus. So let's drive further to see how this is specifically established. So going back to the ventral ramus, we say that the target here is the ventral ramus. So from the ventral ramus, we have a further subdivision into divisions. So the ventral ramus we further subdivide into the ventral division, which is highlighted here at this point. And we have a dorsal division, which is also highlighted here in blue behind. So the ventral ramus further subdivides into the ventral division and also the dorsal division. So if you take it at this point here that is demarcated here in red, and this is what is used to represent this region that is harrowed here in gray. So if you cut up this region and you try to represent it in this image, we know that the ventral ramus, of course, will extend from L4 to L5, S1, S2, S3, and also S4. Of course, this alignment, we say that it is the ventral rami. This ventral rami, we say they further subdivide into the ventral division, which is highlighted here in red, and also the dorsal division, which is highlighted here in blue. And this is on the path of creating the sacral plexus, which is going to bet at the end, the sciatic nerve. So if you have this kind of presentation, you already have the ventral rami of the spinal nerves along this path, of course, dividing further into the ventral division and also the dorsal division. So let's drive further to see how the sciatic nerve will be formed from this collection that we have established. And also remember, before we drive into this, that we say that the sciatic nerve is like a two-in-one nerve that is wrapped in a single sheet. We have two nerves coming together to form the sciatic nerve. So we have the first branch from the ventral divisions. Remember that the ventral ramus is seen to divide into the ventral divisions and also the lower division. So we have one of the subcomponents of the sciatic nerve emerging just from the ventral divisions. And we have the second component of the sciatic nerve emerging from the dorsal division. But for the ventral division first, we have the ventral divisions, of course, of the anterior rami from L4, L5, S1, S2, and also S3 spinal nerves. And this is what is seen to be harrowed here in yellow. And this emergence at this point creates the tibia component of the sciatic nerve. Then if you go to the other side, we say we have the second subcomponent of the sciatic nerve, which of course will emerge from just the dorsal divisions. So we have the emergence from the dorsal divisions of the anterior rami, of course, of L4, L5, S1, and also S2 spinal nerves. And at this point here is where we have the emergence of the common fibular component of the sciatic nerve. So you see that at both divisions, on both the anterior and the posterior part, which of course is the same as the ventral and also the dorsal divisions of the anterior rami from L4 to S3, is where we have the emergence of the sciatic nerve. So these two regions, we create like a contribution from each end, and these ends we then come together at this point that is harrowed here in black to then form the sciatic nerve. So the sciatic nerve, basically going back to the root, is seen to emerge from two subcomponents. One, of course, emerging from the ventral division, which of course is the tibia component. Then the second component will emerge from the dorsal divisions, and this is the common fibular component. And at this end, each of these components will also be forming their individual nerves. As we drive through this lecture, we would be establishing at a point where the sciatic nerve will finally divide into their individual separate components, so that at the end, the tibial nerve component will eventually become the tibial nerve, while the common fibular nerve component will eventually become the common fibular nerve. So that is the interesting part that the sciatic nerve presents. But going back to the root of how it emerges, it's good for us to establish the distinct pattern of its formation. Also, driving deep into this, it's good for us to establish this fact that when we have an injury that is targeted on the S3 spinal nerve, if you look at the differences in terms of how the tibia and the common fibular component of the sciatic nerve emerge, you see that the S3 spinal nerve is what distinguishes the emergence of both components. For the tibial component, we know that it extends to the S3 spinal nerve, while the common fibular component stops at S2 spinal nerve. So if there is an injury that is targeted at the S3 spinal nerve, it is definitely going to be affecting the tibial nerve, because it is only the tibial nerve that extends its origin or formation to this level. This will mean that the muscles that the tibial nerve innervates will definitely be impaired. So it's good for us to be able to establish this fact. So after the emergence of the sciatic nerve, as we described in our previous slide, we know that the sciatic nerve is an emergence from the sacral plexus that is located within the pelvic cavity. This nerve will need to exit the pelvic cavity to run through the regions of the lower limb. Specifically, the initial region that it will pass through is the thigh. So let's see how this nerve will run and exit the pelvic cavity, of course, running through the posterior region of the thigh. So using this image here, this is where we have the sciatic nerve here, harrowed in blue. And after its emergence from the pelvic cavity, of course, from the sacral plexus, you see it passing through the greater sciatic foramen. This is the greater sciatic foramen here, harrowed at this point. This is the foramen that is created at the posterior part of the pelvic cavity. Specifically, it is created around the region of the ilium. This greater sciatic foramen is formed by the sacrospinous ligament. And this is the sacrospinous ligament here highlighted in this region. And you see the sacrospinous ligament, all we need to do, as I've always said on this channel, is to break down the name. It means a ligament that is connecting the spine of the ischium, which is around this place, to the sacrum. And through this connection, this sacrospinous ligament will be transforming the greater sciatic notch into the greater sciatic foramen, which will now create like a pathway for the sciatic nerve. And it is through this foramen, which is the greater sciatic foramen, that the sciatic nerve will pass through. Specifically, it will be passing below the piriformis. This is the piriformis here highlighted in green. The piriformis is seen to emerge from the anterior surface of the sacrum at the front, and you see it also passing through the greater sciatic foramen before it is finally inserted on the greater truncator of the femur. This is what is seen to be highlighted here in green. This piriformis muscle is seen to divide the greater sciatic foramen into the superior part and also the inferior part. So it is below the piriformis that the sciatic nerve we pass through, of course, within the greater sciatic foramen. And if you look at this image here, this is what is presented at this point. The structure that is highlighted here in gray is the piriformis, and you see the sciatic nerve passing below it, and this is what is presented here in this image. So it's good for us to be able to establish the path that it runs in being able to exit the pelvic cavity before it is then finally directed to the posterior region of the lower limb. And the first region at this point is the thigh. So let's see how it runs within the thigh and also the branches that it gives around this region. And if you go back to our previous slide, when we try to establish the structural configuration of the sciatic nerve, we say that it is like a two-in-one nerve that is seen to have a tibial component and also the common fibular component. Using this image here for a better illustration, this is where we have the sciatic nerve here highlighted in blue. After it exiting the pelvic cavity, it is directed towards the posterior region of the thigh. And around this region, also because we already stated that it has a tibial portion and also a common fibular portion. So the tibial portion within the posterior region of the thigh will be giving off branch to the adductor magnus. So it gives off a branch here that is highlighted here in red to the adductor magnus. It's also seen to supply the hamstring muscles. The hamstring muscles, we know that they are located at the posterior part of the thigh. This muscle is being supplied or innervated by the tibial portion of the sciatic nerve around the posterior region of the thigh. And this is what is seen to be highlighted here in red. We know that the hamstring muscle is made up of the biceps femoris. It's made up of the semitendinosus and also the semimembranosus. All these three muscles are taken as the hamstring muscle, and all these muscles are innervated by the tibial portion of the sciatic nerve within the posterior region of the thigh, except the short head of the biceps femoris. So we see that all except the short head of the biceps femoris will be innervated by the tibial portion of the sciatic nerve, and this is around the posterior region of the thigh. So the common fibular nerve would then be giving supply to this section. That means it would be supplying the biceps femoris, specifically the short head of the biceps femoris. You can see that the posterior component of the thigh is taken up by the different portion of the sciatic nerve, where we have the tibial portion taking up the chunk of the muscular innervations of this region. Of course, the common fibula is seen to only innervate the short head of the biceps femoris. So this is what is presented around the posterior region of the thigh. Of course, this sciatic nerve will further proceed in its journey down the lower region of the lower limb. So let's go through the subsequent slide to be able to establish the path that it runs around the space. After the sciatic nerve runs through the posterior region of the thigh, the next region that it will be seen is in the popliteal fossa. So let's see what the sciatic nerve exhibits within the popliteal fossa. So looking at this image here by the side, this is where we have the popliteal fossa here arrowed in black. The sciatic nerve is represented here in blue. So at the upper border or the apex of the popliteal fossa, we have the sciatic nerve dividing into the two major structural components, and these are a larger tibial nerve, which is represented here, and also a smaller common fibular branch that is also referred to as a peroneal branch, and this is arrowed here in purple. So you see that the sciatic nerve at the upper border of the popliteal fossa is seen to divide into its two major branches. And if we go back to where we started this lecture, we already established that the sciatic nerve already is like a two-in-one nerve that is held together in a single connective tissue. Of course, it is at the upper border of the popliteal fossa or the apex of the popliteal fossa that they are seen to now structurally divide into what they are made up of. And this is a larger tibial nerve and also a smaller common fibular nerve. This common fibular nerve is also referred to as the peroneal nerve, and this is what is represented here in this image. You see that the tibial nerve appears to be larger than the common fibular nerve, and this can be attributed to the fact that the tibial nerve has a larger root. Going back to the beginning of this lecture, where we try to establish the root of the sciatic nerve, we say that the tibial component extends to the third sacral spinal nerve, while the common fibular nerve is limited to the second sacral spinal nerve. So because of this orientation, in terms of how they originate, you see that even from the root, the tibial nerve appears to have a larger site of origination, and this is why it appears to be larger than the common fibular nerve. Going to the different divisions that the tibia and the common fibular nerves will give around the leg region, we have tried to establish the different branches of the tibia and the common fibular components of the sciatic nerve within the posterior thigh region. But for this slide, we would be establishing the different branches that the divisions of the sciatic nerve, which include the tibia and also the common fibular nerve, would give around the leg region. For the two branches that emerge from the sciatic nerve, we have the sciatic nerve here arrowed in black, dividing into a larger tibial nerve, which of course is arrowed here in red. And this larger tibial nerve is seen to provide both motor and also sensory innervations. So this nerve is seen to provide motor innervations, of course, giving innervations to the muscle around the posterior region of the leg and also some intrinsic muscles of the foot. And this is what is seen to be highlighted here in dotted red. So you see it going down, giving muscular branches to the posterior region of the leg and also giving muscular branches to some intrinsic muscles of the foot. It is also seen to give sensory innervations. So these sensory innervations are basically given to the sole of the foot. And this is what is highlighted here in dotted red. So you see it's giving both motor and also sensory innervations. Then also we have a smaller common fibular nerve, and this is what is seen to be arrowed here in purple. This smaller common fibular nerve is also referred to as a peroneal nerve, as we highlighted in our previous slide. This nerve is also seen to give both motor and also sensory innervations. So let's see where it supplies in terms of its motor and sensory innervations. So for the motor innervation, you see it's giving off muscular branches to innervate muscles in the lateral and also the anterior regions of the leg. And this is the supply here that is highlighted in dotted green. It is also seen to give motor innervations to some intrinsic muscles of the foot. And this is what is seen to be highlighted down here, also in dotted green. So you see that the motor innervations from the common fibular nerve or the peroneal nerve is given to muscles around the lateral and also the anterior regions of the leg. It's also seen to supply or innervate some intrinsic muscles of the foot. What of the sensory innervations of this common fibular nerve? The common fibular nerve is seen to give sensory innervations to the dorsum of the foot. And this is what is saying here to be highlighted in dotted green. So it's good for us to be able to highlight the specific regions that they innervate in terms of their motor and also sensory innervations. It's also important for us to add that we have the formation of the sural nerve. This sural nerve is formed from both the tibial nerve and also the common fibular nerve. And if you try to use this second limb here as illustration, you have the emergence of a branch from the tibial nerve here that is highlighted in dotted yellow. Then we also have the emergence of a sub-branch from the common fibular nerve that is also highlighted in yellow. And these two branches will unite to form the sural nerve. It means that the sural nerve is formed from the contribution from the tibia and also the common fibular nerve. And this sural nerve is seen to give solely sensory innervations. So you see it's supplying the sensory innervations of the posterior lateral part of the leg and also the lateral side of the dorsum of the foot. And this is what the sural nerve is saying to innervate. And it's good for us to be able to establish this. So even though the tibia and also the common fibular nerve are saying to give their own individual innervations, they are also saying to contribute to the formation of the sural nerve. So if we try to summarize this slide, you will see that the tibia and also the common fibular nerve are seen to take up different regions of the lower limb. For motor innervations, the tibial nerve is seen to supply muscles in the posterior region of the leg, while the common fibular nerve is seen to supply muscles in the lateral and also the anterior regions of the leg. You can see that for motor innervations, these two nerves are seen to take up different regions of the leg. While for sensory innervations, the sensory innervations of the sole of the foot is provided by the tibial nerve, while the sensory innervations of the dorsum of the foot is supplied by the common fibular nerve. Also to add that these two nerves will come together, giving up branches to form the sural nerve. I will be putting up a separate lecture on both the tibial nerve and also the common fibular nerve. So please watch out for this. So going to clinical and applied anatomy, we look at sciatica. Sciatica is a pressure or damage that occur on the sciatic nerve. When this damage occurs, we know that the sciatic nerve is seen to supply different muscles around the lower limb and also provide sensory innervations to different regions also around the lower limb. So there's going to be the experience of weakness of muscle, there's going to be pain, there's going to be tingling action, ache, and also burning sensation. And treatment option, this damage may recover on its own, and when it persists, pain relief drugs can be used. And in a more advanced stage, there may be the need for surgery where there's going to be the relief of the compressing agent. Maybe when we have herniated disc, and this disc is putting pressure on the sciatic nerve, there's going to be the need to perform surgery to arrest the problem that is causing this effect. Then also during intramuscular injection in the gluteal region, the cause of the sciatic nerve is usually considered. And this is why this injection is usually given at the upper lateral quadrant of the buttocks, so as to escape the path of the sciatic nerve. So let's check our understanding of this lecture. And the first question is to describe the root of the sciatic nerve. This we have described in details during the course of this lecture. The second question is the sciatic nerve divides into what and at what level? So we know that the sciatic nerve, of course, runs along the posterior part of the thigh before it finally divides at a point into its two major structural components. And the third question is the common fibular nerve supplies what regions of the lower limb? This we have also adequately highlighted in terms of its motor and also sensory innervations. And the last question is what is sciatica? So thanks for watching this video. Let's continue to stay glued to this channel.